The latest guideline have been saying that at any point of time of pregnancy, it is suitable and they are all safe. Initially, at the very beginning of this pandemic, we had issues in terms of the safety of the vaccines.
Hi everyone and welcome to Ask Me Doctor Season 3, a health video series for you and your family. I'm Mahira Khan from Motherhood.com.my. Pregnancy can sometimes be an uncertain and stressful period in the best of circumstances. But during a pandemic, that anxiety can quickly multiply. The risks of COVID-19 pandemic are especially higher for pregnant moms as they may experience more severe symptoms of the illness. Therefore, it's important that pregnant moms take extra precaution to protect themselves to ensure a safe and healthy pregnancy. But what are the must-knows or steps that can be taken to lower the risks that the COVID-19 virus might pose to the mom or her developing fetus? Well, today we're honored to have Dr. Victor Chin, a gynecologist and obstetrician from Columbia Asia Hospital, Cheras, to answer some of the questions and give us some useful advices on navigating a safe and healthy pregnancy as we enter into the new phase of the COVID-19 pandemic. Hi Dr. Victor, how are you today?
Hi. I'm good, thanks.
Yeah?
How about you?
I'm good, thank you. Do you have a good day?
Yeah, so far so good.
Okay, great. So we have a lot of questions lined up for you. Shall we get started?
Yeah, absolutely.
Great. Okay, so my first question for you, Dr. Victor, is what are the risks for me and my fetus if I catch COVID-19 during pregnancy?
Okay, look, during pregnancy, as the uterus gets bigger, the lung capacity or the lung volume reduces along, when the uterus size gets bigger. Therefore, if you have COVID and the COVID is involving the lungs, the mother might find it difficult to breathe. And especially when they get into category 4 or 5 where they might need ventilatory support. They might have to be bedridden for a long time in ICU, receiving oxygen or mechanical ventilation. So in some ways, COVID-19 infection do increase the morbidity and mortality for moms. In many instances, fetus might have to be brought out earlier just to alleviate the symptoms and to allow mom to be able to breathe like usual again. Yeah.
That's sad.
Yeah.
My second question for you is what extra precautions should I take to protect myself from getting COVID while pregnant?
The most popular method is definitely to get yourself vaccinated, and vaccination is the most important method to break the chain of transmission.
Right.
Not only it breaks the chain of transmission, and even if you get the infection, the symptoms will be relatively milder. And there have been studies showing that even pregnant moms getting the infection, the rate of mortality is less than 1%, and the chances of getting admitted into the intensive care is relatively lower as well. That's number one, vaccination. Number two, the hygienic precautions. Make sure that you wash your hands. Try not to get into crowded areas. Put on a mask. Try to hang out in open areas if at all possible. Yeah, so I think our Ministry of Health and our government have been doing great jobs in delineating all the SOPs. As long as we follow the SOPs, I think we should be all right. Yeah.
Okay, so my third question for you is which COVID-19 vaccines are safe for pregnant moms?
All vaccines are safe. Initially, at the very beginning of this pandemic, we had issues in terms of the safety of the vaccines. Therefore, initially the plan was to give between 14 weeks and 33 weeks. However, as time moves on, things keep changing. The latest guideline have been saying that at any point of time of pregnancy, it is suitable and they are all safe, regardless of the type or brand of the vaccine. They work differently, but eventually the aim is the same.
Right. Yeah, because I think a lot of moms out there are more concerned on whether one brand works better compared to the other, but I think generally they all work the same point.
I mean, they might have a different mechanism,
right?
But at the end of the day, the objective is the same. Yeah.
When is the best time to get vaccinated during pregnancy?
As soon as get pregnant, or any time during the pregnancy, you should get vaccinated anytime.
So there's no time within the pregnancy, it can be any time at all?
Yeah, anytime.
Okay, that's good to know. All right, my next question is that I heard some people had reactions after vaccination. Are these dangerous in pregnancy?
The usual reactions would be quite mild, like sore arms, some bleeding at the injection sites, fever, chills and rigor, feeling tired for a couple of days. But so far, there is no symptoms or complications or side effects that's or what we call as adverse effect to the point where it jeopardizes the health of the mother and the fetus. So, I still believe that vaccine is the best way to go for the protection of COVID-19 in mothers.
So my final question for you is, how can I lower my stress as a pregnant mom during COVID-19?
Just keep yourself healthy, happy by doing what you like. Stay away from crowded areas if possible. Just enjoy the journey of pregnancy, get vaccinated, and you have a healthy and happy fetus.
Great. Okay, so we're done with all the questions. Thank you so much, Dr. Victor, for your time.
Thank you kindly for having me today.
You're most welcome. And to all our viewers, we're giving away special goodie bags worth RM50 ringgit to 5 lucky winners. To win this giveaway, all you have to do is, number 1, tell us when is the best time to get vaccinated during pregnancy, and number 2, tag 3 friends and share this video. Make sure that your account is set to public mode. And a special thanks to Enfamama A+ for supporting today's episode of Ask Me Doctor. Remember to never disregard any signs or symptoms and always seek professional advice as soon as possible. You may book appointments with our doctors should you have any doubts. Search Colombia Asia Hospital Cheras to book your appointments today. Well, we hope that you enjoyed watching today's episode. Be sure to tune in to more episodes coming up. We have a lot of exciting things lined up for you. Till next time, I'm Mahira Khan.
I'm Dr. Victor.
This is Motherhood.com.my. Bye.
Bye-bye.